this video we are going to start the internal surface of base of skull. So actually this is if you remove the calvaria cap on the above, and if you see from the inside the skull looks like this. So from the inside the skull is divided into the anterior part, middle part and the posterior part. You can also call it as anterior cranial fossa, middle cranial fossa and posterior cranial fossa. So in this video we are going to mainly discuss about the anterior cranial fossa. So first let us start with the boundaries of anterior cranial fossa. So if you see anteriorly, there is two sides of frontal bone. You can see this is the two sides of frontal bone, and posteriorly it is separated from middle cranial fossa by means of a posterior border, and this posterior border is formed by the lesser wing of sphenoid. So this is the lesser wing of sphenoid which is forming the posterior border of the anterior cranial fossa. And now coming to the this lesser wing of sphenoid, it is also having an anterior clinoid process. This anterior clinoid process is also forming a posterior boundary and also the anterior margin of sulcus chiasmatus. So this is a sulcus chiasmatus and this is its anterior border. So these all are forming the posterior border of anterior cranial fossa. So once again let us repeat them. That is the lesser wing of sphenoid. In the lesser wing of sphenoid only there is anterior clinoid process, and also there is anterior border of sulcus chiasmaticus. So these are forming the posterior border of anterior cranial fossa. Now let us discuss about the floor. So what is forming the floor of anterior cranial fossa? The floor is in the median plane. The floor is formed anteriorly by cribriform plate. So this is the cribriform plate of ethmoid bone. This is the ethmoid bone, and this you can see many sieve-like structures. This is the cribriform plate. And posteriorly it is formed by the superior surface of anterior part of body of sphenoid. So this is the body of sphenoid. This is the superior surface of body of sphenoid. It is also called as jugum sphenoidale. So this is called jugum sphenoidale. So anteriorly formed by ethmoid bone, cribriform plate, posteriorly formed by sphenoid bones, jugum sphenoidale. Okay, and this is about floor. Okay, the median floor is formed by these two bones. Now let us see on sides. On sides the floor is formed by, mostly it is formed by orbital plate of frontal bone. This is the orbital plate of frontal bone. Okay, and also it is formed by completed posteriorly by lesser wing of sphenoid. This is the lesser wing of sphenoid. So these are the floor of the anterior cranial fossa. Now let us discuss some other specular features of anterior cranial fossa. So if you observe the anterior cranial fossa in detail, the cribriform plate is of ethmoid bone which separates the anterior cranial fossa from the nasal cavity below. So actually nasal cavity is below, so this separates the anterior cranial fossa and nasal cavity. And now coming to this shape, if you see this is like a quadrilateral shape. Okay, and now coming to anterior margin. The anterior margin of this cribriform plate articulates with the frontal bone at the frontoethmoid suture. Here you will having the frontoethmoid suture. Okay, which is marked by a median plane by foramen cecum. Here at this point you will actually have the foramen cecum. It is usually blind, but sometimes it may also be patent. Now coming to the posterior margin of this ethmoid bone, this posterior margin articulates with the jugum sphenoidale here. Okay, and at posterior lateral corners there are posterior ethmoid canals. You can see these are called as posterior ethmoid canal. Clearly it is mentioned. This is the posterior ethmoid canal on posterior side of ethmoid bone. Now coming to the lateral margins of ethmoid. Now you can only say clearly it is formed by orbital plate of frontal bone. So they will articulate with the lateral side of ethmoid. This lateral side of ethmoid is also called as labyrinth of ethmoid bone. Okay, in the suture between them presents the anterior ethmoidal canal. So in between this suture you can see a canal that is called as anterior ethmoidal canal. So anterior ethmoidal canal is present on lateral side of ethmoid bone. Posterior ethmoid canal is present on posterior side of ethmoid bone. Okay, and in the middle of the ethmoid bone you can see a projection that is called as crista galli. So you can see this is the crista galli. Okay, and if you observe the relation of this anterior, so if you see the relation of this anterior canal it is behind the crista galli. Okay, so that is also important point. So on the sides of crista galli, I can see many foramens. So what is that foramen present for? For many anterior ethmoidal nerve and vessels which pass to the nasal cavity from the anterior part of this cavity. So from this anterior cavity, they will go into the nasal cavity by means of this cribriform, like many sieve-like structures. And this plate is perforated by numerous foramina for passage of olfactory nerve rootlets. So olfactory nerves will pass, and also the anterior ethmoidal nerve and vessels also will pass through it. Now coming to jugum sphenoidale, the jugum sphenoidale separates the anterior cranial fossa from the sphenoidal sinuses. Actually, inside you will have many sphenoidal sinuses. So they are separated by jugum sphenoidale. Next, coming to orbital plate of frontal bone. So this is called as orbital plate on two sides. Okay, the orbital plate of frontal bone separates the anterior cranial fossa from orbit, and it also supports the orbital surface of frontal lobe of brain. And the medial margin of this plate covers the labyrinth of ethmoid, and posterior margin articulates with the lesser wing of sphenoid. So everything is very clear here. Now let us discuss about the lesser wing of sphenoid. The lesser wing of sphenoid is broad medially, where it is continuous with the jugum sphenoidale and tapers laterally. You can see the taper and laterally, okay? Tapers laterally. The free posterior border fits into the stem of lateral sulcus of brain, and it ends medially as prominent projection called anterior clinoid process. So two side you have this two anterior clinoid process. Inferiorly, the posterior border forms upper boundary of superior orbital fissure. So you can see here clearly it is mentioned this is a superior orbital fissure. So for that the lesser wing is forming the, especially the lesser wing's posterior border is forming an upper boundary for superior orbital fissure here. And medially the lesser wing is connected to body of sphenoid by anterior and posterior roots. Actually this is anterior root, this is posterior root. So by these two roots, this lesser wing of sphenoid is connected to the body of sphenoid here. Okay, and it is enclosing an optic canal. So this lesser wing, anterior and posterior roots are enclosing an optic canal. This is the optic canal. So optic canal towards this side, anterior root towards this side, posterior root. So this is about the anterior part, anterior cranial fossa of interior of skull. We will also discuss the clinical anatomy. That is, the fracture of this anterior cranial fossa may cause bleeding and also discharge of cerebrospinal fluid through the nose, because here you are having cribriform plate. So all the CSF contents will go by means of this into the nose. Okay, and it may also cause a condition called black eye, because from here, as we discussed, the olfactory nerve rootlets also will go, and also the ethmoidal nerve and vessels, anterior ethmoidal nerve and vessels will go. So because of that, then from the nose the cerebral spinal fluid may come out, and also the eyes may become black, and this is produced by seepage of blood into eyelid. So some of the blood will also go into eyelid, as frontalis muscle has no bony origin. So this is about clinical anatomy. Next we'll discuss about the medial cranial fossa.